Well, what inspires me about being in ophthalmology, and it's now close to 35 years, I think is at the end of the day, helping people see better is a pretty inspiring, noble way to come to work. And in those 35 years, I've had the opportunity to see some wonderful things. You know, in the early days of corneal refractive surgery, to see somebody get up off a table and look across the room and see for the first time without correction and see tears coming down the cheeks of people is pretty inspiring, if you will. To be able to travel to the far reaches of the world like India and China, where people are going blind simply because a lens is cloudy, and you know, it's so preventable by increasing access. So I think, you know, those kinds of experiences, you know, certainly have kept me motivated and inspired to be part of this wonderful journey we're all part of here at, you know, the Ophthalmic Innovation Summit and on the eve of the American Academy of Ophthalmology meeting. Well, I think, again, having an uber purpose. You know, we have a bold ambition that we want to change the trajectory of eye health. And I think, for me, culture does trump everything. And I think if you create that kind of culture and you have that kind of purpose around, you know, really changing the way people think about eye health, I think you can accomplish wonderful things, whether you're a small company or whether you're a big strategic like Johnson & Johnson. That's what motivates me and certainly, hopefully, motivates our entire team. Well, again, I think, you know, with that uber focus of changing the trajectory of eye health, we think you can do that in a lot of different ways. You know, certainly here at the American Academy of Ophthalmology meeting, we have wonderful opportunities to information share, peer-to-peer, hands-on user meetings, you know, certainly podium presentations around our technology, some interesting new data that we'll be showing relative to our Technis portfolio of presby-correcting IOLs, as well as our eye design studio and the impact it's having on personalizing LASIK and taking it to the next level. So I think we're always excited about the next wave of innovation. You know, we've been the leader in presby-correcting intraocular lenses for a while now, and we'll continue to look to raise that bar. I think from a dry eye point of view, we're equally excited about treating the underlying cause of dry eye, which is meibomian gland dysfunction. And through our imaging of LipiScan and our treatment of LipiFlow, we're excited about that and want to continue to expand that opportunity in dry eye. Because if you think about it, and we've talked about this in the past, Tom, you know, keeping a healthy ocular surface is so paramount to great outcomes, whether it's cornea-based refractive surgery or lens-based refractive surgery. So I think that whole continuum from the surface to the cornea to lens are areas that we're going to continue to try to innovate in. Well, I think a lot has happened over the course of my career in ophthalmology, but I also believe the best days of ophthalmology are ahead. Certainly demographically, it lends itself to that. I think innovation will continue to be rewarded. But I think as an industry, we have to continue to be smart. It's not just about technology. It's how is it going to be paid for? How do we help our customer become more efficient at what they do? How do we deliver care in a more efficient way? So I think the next 5 to 10 years are going to be as exciting as the past 5 to 10, and that's what keeps me motivated and inspired about being part of this wonderful ecosystem. You know, I've gotten an awful lot of advice over the years, but I think one that has stuck with me for a long time is, you know, in any type of relationship, be it personal or professional, you know, you never knowingly want to disappoint somebody. And I've tried to maintain that in my professional life in particular. I'm going to say something that you won't like, and you're going to say something I don't like. And that's just life. But at the end of the day, let's not knowingly disappoint one another. And I think if we maintain that kind of culture, again, in our organization in particular, I think good things happen. Yeah, I think in terms of you know, what's an operating principle that I want to hold dear to, you know, I think, as I mentioned earlier, creating a positive culture, I think, is very important. And how you do that is just maintaining you know, honesty and truth to yourself, you know, maintaining integrity. Certainly at Johnson & Johnson, and I believe it as well, I think what we do and how we do it is equally important. And I think when you maintain that kind of integrity, you create a culture that allows people to really be the best they can be. And I think that's something I hope I never compromise. No, I think OIS, as you and I have talked over the years, Tom, I've been to every one for the past 10 years. I think that's about 19 events, and it's just a wonderful ecosystem. When I was involved in startup companies, it obviously created an environment to come and network with either money people or strategics or clinicians to get our message out. And now being part of a major strategic acquirer like Johnson & Johnson, it's a wonderful environment to come and keep abreast of what's new and what's exciting as we look to continue to enhance our portfolio. So my association with OIS has been personal and professional, and something I've enjoyed for the past 10 years and look forward to the future.